Chairperson of the Eastern Metropolitan Palliative Care Consortium. Personally, that's my work life. Personally, I'm also out as a proud gay man that kind of first discovered palliative care nearly 35, 40 years ago during the AIDS epidemic, and was involved in the Victorian volunteer community responding to the epidemic, as well as a beloved friend or a friend and carer of a beloved friend. And that's really where I first discovered palliative care. I'd now like to acknowledge country. Palliative Care Victoria acknowledges the traditional owners of the land on which we meet today, the Wurundjeri Woi Wurrung and the Bunurong Boon Wurrung peoples of the Kulin Nation. We pay our respects to the elders past, present and emerging. PCV also acknowledges traditional owners of country where palliative care services are delivered throughout Victoria, and we recognise their continuing connection to lands, waters and communities. We pay our respects to Aboriginal and Torres Strait Islander cultures and to elders both past and present. And I'd also like, as a hospital, to acknowledge the Aboriginal people that are currently in our care across all of the services in Victoria at the moment. The other acknowledgement I'd like to do is acknowledge that it is National Palliative Care Week this week, and you've signed up for the webinar, My Choices, My Rights, a conversation on LGBTIQIA plus rights in palliative care. And the other little acknowledgement I'd like to do is that it's Ida Hobbit Day on 17th of May. Ida Hobbit stands for International Day Against Homophobia, Biphobia, Interphobia and Transphobia. It's a global day of action and awareness celebrated annually on the 17th of May, aiming to combat discrimination against the LGBTIQA plus community. The theme this year is the power of communities, celebrating the strength, resilience and diversity of the LGBTQIA plus communities and our allies, and emphasising the importance of solidarity in driving change and inclusion. Kind of timely to have this seminar tonight. So my role tonight is to introduce you to your speakers and to give you an overview of tonight's program. From a housekeeping point of view, you're aware that recording is already occurring. I would ask that you keep yourself muted, and my preference is to see your beautiful faces at the end of the camera, but you have choices there. You can be the silent or the non-visible type. We will have Q&A at the end after each speaker presents, and we'll use a chat function for your questions. And there's an opportunity for evaluation to be completed at the end. My next important task is to introduce you to Violet Platt, who's our CEO of Palliative Care Victoria. Violet is a registered nurse with over 30 years of experience in cancer and palliative care nursing. Working in England, the Isle of Man and Australia in a variety of settings include hospital, hospice and the community. Violet has a Master's in Nursing Research, an Executive Masters of Business Administration, and is currently undertaking a PhD in palliative care for people experiencing homelessness. In 2016, Violet received a Lifetime Achievement Award from the Western Australian Nursing and Midwifery Excellent Awards in recognition of her contributions to cancer and palliative care nursing. I'll give it to you, Violet.
Thanks, Michael. And hello, everyone. Thank you for joining us on this very special night. I want to give a special thanks to our distinguished speakers and to our fabulous MC, Michael Brownwell. And we did have a lovely little reconnection that took us back to those early days when we were all looking after HIV positive patients and trying to... Can't see me. All right, I'm on... You can't see me, it's probably a good thing for you. I will keep working on my camera as I'm talking. Michael and I had a really good conversation about our early memories of working with people in the community in the HIV positive days. Michael with his friends and myself as a student nurse on the wards in Manchester in Withington in England. As Michael said, it's National Palliative Care Week. and we're celebrating over 30 years now of trying to activate conversations, raise awareness about palliative care, and advocate for better access and acceptance of palliative care. We know talking about our mortality and death is difficult, but it's something that we should do, and we should actually do it while we're not well and not faced with ill health and difficulty. This year's theme is What's Your Plan? And tonight is about providing you with some useful information to help you with that question. As a peak organisation, Palliative Care Victoria is working towards gaining the Rainbow Tick accreditation, and we really value the input from all members of the LGBTIQA+ community, and we encourage you to join the question and answer session so that we can hear from you. We know that there are unique challenges for members of the community, and a large body of international and Australian research has established the significant disparities in health and well-being for the community members compared to the general population. And we know there are associations there with stigma, discrimination, violence, abuse, homophobia, etc. These experiences we know have contributed to barriers in accessing health and community services, and we really want to work to make sure that every Victorian gets equal access to the care that they want, where they want it, with the team that they want to provide that care. We want to make that change, to influence that change, and to work with you all towards that change. So please do feel free to share your thoughts tonight, and in the future as we carry on developing this work, please feel free to connect with Palliative Care Victoria as we go along this journey. Thank you, and I will hand you back to Michael.
Thanks, Violet. So tonight we've got 3 speakers, and I'm delighted to introduce them collectively now, but we'll go through, give you an introduction to the people individually. So our 3 presenters this evening is the LGBTIQA+ Commissioner, Jo Ball. Our second speaker is Kavitha Sivasamy, who's a lawyer with the South East Monash Legal Service and Justice Q. And then the third speaker is Jen Walsh, who's the lead developer of Barwon Health's Rainbow Toolkit, who's now with Deakin University. So let's start the presentations, and it's my great pleasure to introduce you to Jo Ball. Jo Ball was appointed as the new Victorian Commissioner for the LGBTIQ+ communities in September 2024 for a 3-year term. Commissioner Ball is a proud transgender man. The Commissioner advocates for the rights, safety and wellbeing of the LGBTIQA+ communities. He's a long-standing LGBTIQA+ advocate and former CEO of Switchboard Victoria, with a 25-year career in disability, housing and homelessness and social services. During his tenure with Switchboard, Jo led the establishment of the statewide LGBTIQA+ family violence and mental health helpline called Rainbow Door. Throughout his expansive career, Jo has drawn upon the strengths and guidance of the LGBTIQA+ history, and most importantly, the work of the activists who have paved the way, the courageous voices with lived experience and the wisdom of LGBTIQA+ elders. Commissioner Ball is also a member of the Expert Advisory Committee or Expert Advisory Group for the Federal Government's 10-year LGBTIQ+ Health and Wellbeing Plan, and previously participated in several leading social service advisory committees and boards. This includes the Victorian Family Violence Peak Body, Safe and Equal, the Community Advisory Committee for 1800-RESPECT, the Victorian LGBTIQA+ Task Force, the Victorian Family Violence Reform Advisory Group, and the National Suicide Prevention Governance Committee. In 2020, Jo was honoured as an award recipient in the 50 Outstanding LGBTI+ Leaders in Australia. My enormous pleasure to introduce you to Jo.
Thanks, Michael. It's always a lot to sit through your own bio, isn't it? I always think I've got to, every time I think I've got to shorten it. Look, it's an absolute pleasure to be here today, and I think you'll see themes run through the different speakers of things that we share and things that have brought us together. Today, I'm on the lands of the Bunurong people, and I'd like to pay my respects to the elders past and present. I'm coming to you from the Victorian Pride Centre, which is on Bunurong country. And I want to begin by thanking Palliative Care Victoria for hosting today's event and for your leadership in this space. I also want to acknowledge that the toolkit that we're relaunching as an expanded and statewide accessible, a far greater resource than it started, but the original incredible work that is being built on tonight that we're relaunching started with Barwon Health and with Jen Walsh. Jen introduced me really to palliative care when I first came across the resource, and is a huge champion and advocate in this space, and certainly is the conduit for my passion in this space. So it's lovely. It's a great honour to be here, relaunching and seeing the expansion of this incredible work. As you said, as we all know, it's Palliative Care Awareness Week, which is a time to reflect on the importance and equitable, compassionate care for everyone at the end of life. And it does correspond also with Ida Hobbit Day, which I think is, Michael so beautifully spoke about the connection of that.
If I turn my speaker down.
Am I okay? Can you hear me? Oh, okay, cool. As we gather here today, I want to take a moment, though, because it is Ida Hobbit on Saturday, to acknowledge that in many parts of the world, it is still illegal to be gay, to be trans, or to live openly as a member of the LGBTIQA+ community. Some countries do still enforce the death penalty. In Hungary this year, we've seen the making illegal to run a pride parade. And in the United States this year, we've seen the word transgender has been removed from every federal government website. Just to name a few examples of that, we're not talking about historical discrimination, but current today discrimination. I think it's worth saying, in Ida Hobbit, the first word is international. And so what happens to our siblings overseas does affect us here in this country. It affects our ability to travel overseas, but it also, we love people over there, we care about them deeply, and we feel connected to them as siblings. So the fear, grief, and solidarity is across borders. So today we hold those people in our hearts, in our global community, for whom an event like this, having a public launch of an LGBTIQA+ inclusive palliative care resource, would actually be impossible. We dream of a world where dignity, safety, and affirmation are not the exception, but they are the norm. As the Commissioner for LGBTIQA+ communities, I often speak about strength and joy and resilience for our communities, about the ways and things that we have survived, resisted, and created through our chosen families and our families of origin in the face of systems that have failed us. But today I want to talk about something perhaps more vulnerable, and that's what we're all here for, to talk about how we die and how we are cared for as we approach the end of our life. Because for too many LGBTIQA+ people, the end of life has been marked by erasure or exclusion, by a fear of being misgendered, by anxiety that our partners or our chosen family will be sidelined, by the pain of needing to explain one last time who we are and who we love. These fears are not imagined, they are lived every single day. We must never forget the legacy of the AIDS crisis. In the 1980s and 1990s, an entire generation of gay, bisexual, and queer men, trans people, and people living with HIV faced death not only from illness, not only from the pandemic, but from neglect, discrimination, and social abandonment. Many died alone, partners were denied access, and funeral homes even turned some people away. Families erased whole identities after death. That grief, that injustice still lives in our communities, and it's shaped our politics of care and how we understand care. It's why we talk about chosen family as well as our family of origin, and it's why we form mutual aid networks. It's why we say, never again will we let each other die in shame or in invisibility. And that's what makes today's relaunch of this new expanded toolkit actually so significant. This Rainbow Toolkit is not just a resource, it is actually a commitment to safety, to visibility, and to dignity. It gives healthcare professionals the tools to provide affirming, appropriate and respectful care. And it gives LGBTIQA+ people and their loved ones reassurance that their identity will be honoured at every stage, including at the end. This updated toolkit reflects a deep listening to our community. It includes the lessons we've learned, the stories we've shared, and the changes we still demand. And I want to thank everyone involved in this partnership, especially Palliative Care Victoria, Barwon Health and Jen Walsh for making this happen. Because we know that inclusion is not a one-time act, it's a practice across our lifetime. It's a principle. It must be embedded in policy, training, documentation and culture. The Rainbow Toolkit sets out to do that, and it should be a model for health and aged care more broadly. To every LGBTIQA+ person who has ever feared how they would be treated in their final days, this has been made for you. To every clinician who wants to do better, but wasn't sure where to begin, this is for you. And to everyone who believes that dignity belongs to all of us, in life as it is in death, this toolkit is for you. Thank you for having me here today, and thank you for the work that you all do to ensure that our lives and our deaths and our final moments are met with care, with affirmation and with pride. And I'm committed to continuing this conversation, for it is one I know that our community so dearly needs. So thank you very much, and I'll be here for questions and to be part of the event generally. Thank you.
Thank you very much, Joe. Our next speaker is Kavitha Sivasamy. Kavitha is a proud transgender woman of colour from Naarm who's been working as a lawyer for over 5 years and in the legal sector for over 9 years. She currently works as the Justice Q lawyer at South East Monash Legal Service, providing free legal help to LGBTIQA+ people in Victoria, and particularly those based in the South East Corridor of Melbourne. She previously worked at Legal Aid ACT, Canberra Community Law, Slater and Gordon, Morris Blackburn Lawyers and Playfair Visa and Migration Services, and volunteered at numerous community legal centres while completing her studies at the University of Sydney. One of Kavitha's many passions as a community lawyer is preventing and addressing elder abuse. Outside of work, Kavitha enjoys singing, dancing, cooking and spending time with her adorable puppy, Amu. Kavitha, I'll hand it to you.
Thank you, Michael, for that lovely introduction that obviously I wrote and gave to, so it is a bit odd listening to our own stories, as Joe said. But yeah, I thought I wanted to kind of talk to you about what you can legally do when you are sort of thinking about what's going to happen at the end of your life, what kind of planning options you have to make sure that the people making decisions for you are the people who you want to be, in that role. So there's a couple of terms that I kind of wanted to start explaining things in the most kind of simple way possible, because I think quite often lawyers throw around words which mean different things in a legal context to what it might mean in an everyday context. So if you think about most of us in this room, right, we all have something we would call legally decision-making capacity. So we all have capacity to understand information in front of us, process that information, make decisions, weigh up the information, whatever. That can all change. So obviously, if you, for example, you've had like a brain injury and, after an accident or something, or you're developing dementia, that can all change. So the law, this happens very often. So that there are laws around who makes decisions for you if this were to happen. And that's, there are mechanisms in place to ensure that if this does happen to you, there are people who can maybe step in and make decisions for you. But also, and this should be the key takeaway from this session, is, if you want to delegate your decision-making power to someone who you trust in case you lose capacity, there are ways of doing that. There are actually multiple ways of doing that. So, and that's something I'm going to be talking to you about today. What can you do to give decision-making capacity to your chosen family or your friends or people you trust, so that maybe people who you don't like people who like maybe family or something, if you don't trust family, don't kind of try to get in and take that decision-making power away from you. So the legal system in this context, the legal system looks at all decisions and puts it into 3 categories. So there's personal matters, for example, like where do you live, where do you work, etc. There's also medical matters, so that's the kind of treatment that you might be getting, and also financial matters as well. So that's, everything to do with money. Basically, I would say there's 5 things you can do if you want to safeguard your decision-making power, right? And these are things you can do now while you have capacity, because the law obviously, like, once you lose capacity, you can't really be signing documents saying, I want this person to have decision-making power, because at that point, practically speaking and legally speaking, you don't have capacity to be doing that, right? So there are 5 things we can, presuming that we all here have decision-making capacity, there are 5 things we can all do just to ensure that the right people will be making decisions for us in case things decline. So the first thing is called an enduring power of attorney. So that's basically a document where you say that, okay, if I lose decision-making capacity, this is who I want. This is a person, or these are the people who will be making decisions about my personal and financial matters. It's pretty simple and straightforward to make. There are like templates, and it's quite, I think so there are rules around how that needs to be witnessed, but it's pretty self-explanatory. And it doesn't mean that, and something really important to understand is it's not really a black and white thing. Like if I make an EPOA right now, enduring power of attorney, that's what I call EPOA. If I make an EPOA right now and then I like have a car crash, let's hope that doesn't happen, but if that happens, and I've got some capacity but I'm not maybe fully there, the principles of the Act requires, like if let's say I appoint Michael as my attorney, right, for argument's sake, Michael has an obligation to ensure that I'm still supported in every way possible to be participating in my own decision making. So it's only if I don't have that level of capacity as well, then he steps in to make the decision. So it's not that you're not giving up something, but you're just kind of safeguarding. And obviously this is, these sort of mechanisms came into place because not everyone wants their spouse or their parent or their children to be making decisions for them, right? And so that's why these kind of things have come about. So the other thing, that's the first thing, enduring power of attorney. The second one is an advanced care directive. So that's basically an instructional directive where you can say, this is the kind of treatment I would want, this is the kind of treatment I would refuse. There's people of certain religious faiths who don't like or who don't agree with certain treatments. For example, you can also do what's called a values directive. So that describes your views and your values. So, around what kind of treatment you would like and how you would want your end of life to look like. So that is, medical professionals, there's the same legislation that says you can make an advanced care directive that says what doctors have to do if there isn't one, or if someone isn't appointed as your medical decision maker. And, doctors have to consider and look into whether there is already an advanced care directive and say a values directive before they kind of go off and do their thing. So, or talk to the people who they then have to talk to, if there isn't someone or something in place. You can also appoint a medical treatment decision maker. That might be chosen family. And if this is not done, doctors have to turn to, like there is like Section 55, that legislation goes through it, but it's kind of people who you are probably not going to be your chosen family. So if you don't want these things to happen, that's number 3, appointing a medical decision maker. Number 4 is make a will. That is like, if there's one thing you're going to be doing after this, I would say make a will, because I think with will, like it's so important, because when you die without a will, it's like, even if the money goes to the people you want it to go to, there's going to be a massive shit fight between them, just to be like really blunt. And we see that all the time, and it's an absolute nightmare to see, because it's so horrible to see family relationships break down where maybe there was nothing, like, between people before, and then everything just falls like apart. So make a will. If you marry, that will is any will you've already made automatically annulled. So just make a new one. It's just important to make a valid will, because the validity of your will can be tested. So there are make your own will kits, but I would say get a lawyer involved, especially if you feel that you're at a point in your life where you're not planning to marry again, or something like that. Just get a lawyer to do the will properly, and you have to do it while you have decision-making capacity, because one of the ways of will's validity is contested is saying that you don't have decision-making capacity. Sometimes you can get a doctor of law to write that you have decision-making capacity. So talk to your GP about that as well. And, if you're getting a lawyer involved, the lawyer should be telling you about whether it's worth doing that, whether it's not, and whatnot. So, and the fifth thing you can do is just double check who you've nominated as your beneficiary or beneficiaries on your super fund, because when you open a super fund, you have to nominate a beneficiary. But, like, I'm a trans woman, right? And my mum and I are great now, but that wasn't always the case. But when I opened my super fund, this was before everything. So, like, I had my mum, and I think through the turmoil of our relationship, I had my mum, but probably, like, things are now great, so I can keep it as is. But if things didn't, like, often our, we have chosen families because our sort of natal families the relationship isn't the same. So I think just check who you have nominated as your beneficiary, because it's so easy to do that when you're 18 and then just forget about that being a thing. That doesn't form a part of a will, superannuation. So unlike divorce settlements where superannuation comes in, like wills, superannuation doesn't really, it's not covered. So check who the beneficiary on the super fund is. And then look, that's probably the meat of what I want to get across to you. But I just kind of want to talk to, just to emphasize the importance, what might happen, if you don't do these things, right? So just kind of examples. So if there isn't a will, or if there's a will that isn't valid, then your next of kin, so that's, your spouse, your partner, your children, if you don't have children or partners, your parents or something, or your siblings could apply for a grant of letters of administration. So that's basically, there's no will, let's appoint an administrator and to make decisions around who gets the estate or the value of your property, right? And there's complex rules governing all that stuff. But basically it goes to if you don't leave a will saying, I want this to go to Jack, who helped me come out when I was 20 and live my best life and is still my best friend at 80, then it's going to go to your mum, Mary, who threw you out of the house when you were 19 and came out. So it's, it's just not, it's not great. So just do a will and make sure that doesn't happen, because, like I said, you don't want fights as well. If there isn't an enduring power of attorney and you lose capacity because of a car accident or something, then this is actually kind of, maybe it's a bit stressful to hear, but anyone can actually apply to VCAT for guardianship orders. But there are like rules around who can be appointed as guardian. So guardians can only kind of make decisions around personal matters. And like the enduring power of attorney, they've got to make sure that you participate. So this is not if you pass away, but this is like while you're alive, if you have an accident or if you have dementia or something, and you don't have an enduring power of attorney that says, this is the person who will be making my decisions, then anyone can apply for a guardianship order. And there are decisions that guardians can't make, like they can't make wills, for example, but they can make quite key personal decisions about personal matters, like where you live, for example. So that while anyone can apply for that, there's rules around who there's like preference given to, they try to think about, like, consider what you would have liked, and as much as they can tell, and whether you had a preference for relatives, for example. And if no one can be found suitably to appoint as the guardian, then they will appoint the public advocate, which can be, in some situations, that can be a bit tricky for certain things. So yeah, just if you have the enduring power of attorney, then none of this really happens. Basically, that's a key takeaway, because an enduring power of attorney would say who gets the decision-making power. Also, yeah, and then someone could also, if there is an enduring power of attorney, someone could also apply for an administration order as well, which is about your finances. And then, as I explained, if you don't have like medical, advanced care directives or anything, then doctors have their rules under the legislation they have to follow around who then they turn to if your needs and wishes aren't made clear already. So that's kind of a nice overview, I suppose, of like what you can do to safeguard your decision-making power while you have capacity, and what might happen if you don't. And I think, contact, like just get in touch with a lawyer. I'm, by way of background, I'm at the Southeast Monash Legal Service, which is a community legal centre, so we provide free legal advice and assistance. I am the Justice Q lawyer. So Southeast Monash Legal Service has been around for over 50 years, but Justice Q is our new program buy-in for LGBTIQA plus people. But because we're a free service, definitely contact free legal services if you have any legal issues, but just be mindful that they might not always have capacity because they are free services. And things like wills, most community legal centres won't help you actually draft a will. But if there's questions around, around wills or around like I used to do at Legal Aid ACT, I used to work closely with our older persons legal service, and we had a lot of people saying like, oh, my son's trying to apply for guardianship orders. Like, how do I, like, what? Like, I don't want him to have power. Like, so that kind of stuff, if you have questions like that, that's something you could, I think most, like, I mean, I, as a CLC, we would probably, like, if we had capacity, definitely advise you on that. But something like actually making a will is something that's quite complex in its own thing. So that's something that you would usually get a private lawyer to do. So it's, but if in doubt, just contact a community legal centre, and they can always try to redirect you to what might be the best course of action. But I think, I hope that gives a good overview. I hope that wasn't information overload, but I think it was information overload. So, and if you have any questions, obviously there's time for questions at the end. So please do ask away.
Thank you very much, Kavitha. I always talk about, I worked for a palliative care service. The number of staff who you think would know better who don't have a will surprises me. I think it's more than 70% when we did the last audit don't have a will. So you're giving good advice. Our next speaker is Jen Walsh, and Jen is a proud Jen is a proud trans non-binary person living on Wadawurrung land in Ocean Grove. Jen has worked across multiple sectors, including disaster response, volunteer management, palliative care, and LGBTIQ plus inclusive healthcare. Jen's passion is working to make the world safer for queer people of all ages. Jen leads the co-design of a queer inclusive palliative care toolkit, which we're going to hear about this evening, and in 2021 received an OAM for their work in community palliative care. I'm smiling. I'm not a cricket fan, Jen. I have to give you the honesty. In their personal life, you've started up an all-gender cricket team in Geelong, and I'm sure it's a booming success. I'll hand it over to you.
Thank you. And once people hear my accent, it'll seem even more ridiculous that I started up a cricket team. Yes, thank you. And thank you, PCV, for having me here tonight. And I have to say, right off the bat, it's pretty overwhelming and amazing to have also that introduction from the commissioner about the fact that this toolkit is for you. This toolkit is for community, because I think back to when we were developing it, sitting around the table with some cups of coffee, thinking the reason we're creating this is for community. There were so many people saying they don't see themselves in the typical medical documents, which is what the motivation was for creating this. So, yes, thank you for that. And I do want to acknowledge that this toolkit was developed on Wadawurrung land, and that's the land that I'm lucky enough to live, work, and play on. And it's the land where Barwon Health delivers its palliative care services. And a couple thank yous, because these ideas are only ideas until you have some support and also some money to support them. So thank you to Hospice Foundation Geelong, who provided quite a bit of support, as well as the City of Greater Geelong through their grant scheme. Gave us the ability to actually print these documents and get them into the hands of LGBTIQA+ people. And I really, really also want to thank the 4 consumer advisors who were super important on the development of this toolkit. It would not be, I guarantee, would not be what it is today without their input. So Diane, Ellie, Robin, and a special mention to Anne, who actually died in 2022. She worked on this project with us while facing her own health issues, brought her own unique perspective to this because of that, and her partner's perspective. And she was really grateful that she was able to see this document launched before she died. And yeah, about me. So I use they, them pronouns. I formerly worked at Barwon Health. So I feel a bit lucky that I still get to talk about the toolkit, even though I don't work there anymore. And I know there are a couple friendly Barwon Health faces on this webinar tonight. I currently work at Deakin, but in the next fortnight, I'm actually making a bit of a move across the switchboard and their Pride and Aging program, which I'm really excited about, because the aging population within the queer community has drawn me back. So yes, thank you, Ed. Ed behind the scenes is going to help me click through this. So thank you, Ed. I thought the best way to present this document was actually just to walk you through the document itself. Obviously, we can't sit around a table with a cup of coffee holding the book, so this is the next best option. And also conscious of the fact that there are people here tonight who might be clinicians, and there's people here tonight who might be members of community. So I'll talk you through the document in hopes that, depending on where you're coming from, you either find this document helpful to take forward in your own life, or you feel more comfortable talking about it when you're working with patients and families. So one of the things I really want to point out in terms of the design, and this is where it's really important that we had, thanks, Ed, we'll stay here for a minute. It's really helpful that we had consumer advisors. I initially came back to them with some very bold corporate Barwon Health branding, and they just said, absolutely not. We need to make this softer. We need to make it approachable. We need to make it something that you can see in a GP's office and pick up and not feel like you're being outed. And so that's why it's important that these colors are more muted, but yet you do see those 6 colors across the front, which are very important and very noticeable LGBTIQA+ colors. Also, you'll notice throughout that the font is a lot softer, and the lines, the circles, sometimes things look like thought bubbles. It's really designed to look like it's a document that one of your friends or a loved one made for you, or a journal. Again, not like a clinical document. And also, we wanted people to see themselves in this document. It's interesting with all those little pride flags there. The last pride flag is the ace flag, or the asexual flag. And only a couple of months ago, I had somebody talking to me about the toolkit, and they identify as asexual, and they said, I've never actually seen my own flag in a document. And I thought, what an easy thing for us to do, but so impactful for somebody that they can actually see themselves in the document. And then obviously with the other elements there, it's important to realize that people are more than just their queer identity. So, everybody can use this document, and also more supports are needed if, depending on the other elements of your identity. Thank you, Ed. So this is kind of the opening bit of the toolkit, which just walks you through the fact that it's not a typical medical document. It's designed so that you don't have to feel like you pick it up and walk your way through from page 1 to page 30 or however long it is. You can pick it up and engage with it in the way that makes you the most comfortable, which I think in a palliative care setting is really important. People might not be ready to talk about possibly the legal stuff or, certain parts that you'll see laid out in this document, but they might be ready to talk about things like a bucket list. So it was really intentional to say, yes, this is all of the content, but pick a color and start where you're comfortable. So it's a bit of a choose your own adventure. You can walk through it if you want. You can just go to a section that appeals to you. You can even, you can do just one section, or you can just keep it on the coffee table knowing it's there if you need it. That's the intent, is it's very flexible. Thank you, Ed. So starting out with the red section is we realized, and anybody who's here and who is a clinician would know that there's a lot of probably misunderstanding about what palliative care is as a big concept, but also the nitty-gritty details. Where do you access palliative care? What is palliative care? And who is your palliative care team? So it was really important. This section's not necessarily that interactive, but it was important to us to lay out these really basic things in a really basic visual format so that you could get a sense of how palliative care even works. Because for most people, obviously, once you're having an admission onto a palliative care team or program, it can be a very overwhelming experience. So to say, let's just break this down as simply as possible. It's going to be obvious as we walk through this document that there are things that are Barwon Health specific or might be Geelong specific, since that's where we created it. But we've had people pick this up in New South Wales and say they just scribble out the bits that aren't relevant and add on the bits that are relevant for them. So there is that possibility for people. And also with the exciting news tonight that it's going to be rolled out more broadly, there's an opportunity to broaden out some of these topics. Thanks, Ed. The next bit, the orange bit, is all about me. So in some ways, these are some easy bite-sized chunks that people can do, like emergency contacts. There's something really nice about being able to have a sense of accomplishment that you've been able to fill out a page with some easy low-hanging fruit. That second page is actually pretty much left intentionally blank because we wanted to make sure that people had an open-ended way to talk about their important people or their story in a way that wasn't restricted by any fields that we could come up with. And especially with queer identities, the way your relationships, chosen family, all of those kinds of things might exist in your world might be very different than you've seen in other medical documents. So to be able to have some really free space was important, that people could just document whatever was important to them. Then on the next page, so that page that says My Identity, My Body is about jotting down the ways in which people talk about their own identity and their bodies. And what really prompted this was the exhaustion that people feel when they have to come out over and over and over again. So they might come out when they're being admitted to the palliative care program, and then each time they meet a nurse, each time they meet a doctor, whether that's introducing the loved one who's sitting in the room, whether it's introducing your pronouns, your identity, having to do that. Any of us who are on here tonight who are queer will attest to it's exhausting, and it's a thing you don't necessarily want to spend more energy on while you're facing the end of life. So the intent of this is also that you could fill this section out, keep the book flipped open to that page, and when your team comes, you can just have that around or hand it to them, just so that you don't have to be repeating your story over and over again. You can just ask them to have a look at that. Next page, Ed. This is just continuing the About Me section. So on the left, there's a section about my home and my safety. That came very strongly from the consumer advisors around the fact that letting people into your home is very vulnerable. And, so many people want to receive their care at home. So being able to think through how can I control my home environment as much as possible. Often what came up is pets. How do I make sure that the palliative care team knows that my dog will be okay with them being there and not ask me to put the dog out in the garage or whatever the case may be. So again, thinking through some of these things in advance takes away that vulnerability of allowing somebody into your home, and just really conscious of how difficult it is for older people with the history that they've lived through and the discrimination at the hands of healthcare, to let somebody in and see your home, see your artwork, see your family photos can be a really scary thing. So yeah, just again, a chance to think that through and control your environment a little bit. The next three, the My Care team, the appointments and the symptom trackers, are just a way to help people start to wrap their heads around what sometimes is described as the chaos of having a palliative care team coming into your home, or even having, all sorts of symptoms that you're kind of, or that you're trying to track. I do like that on the symptom tracker, the team asked that we add at the bottom, sorry, it's so small on the screen, but the last one for each day is emotions. They really wanted to be able to give people the opportunity to, track their emotions through this journey. Next one, please, Ed. Now we're getting into the yellow section, which is around starting to gather up your supports, or as the consumer advisors kept saying, they really want to gather their team, gather their crew that's around them. So the first bit, and for those who are familiar, there's an organization called Gather My Crew, which was really inspirational to some of the thinking on this page, which is, people often are saying, just let me know if I can help. But if you're the person who needs the help, it can be really hard to figure out how to ask for that help, when to ask for it, who to ask. So the idea was, if we just really clearly articulate those, again, you can have this list that says, I need help with the gardening. I need somebody to go to the chemist and pick up my medicine, or, wash the dishes. And it almost normalizes that those types of support are needed by people if it's written in a book. And that's another thing that came through really strongly. If it's been written in a book, somebody else has thought about it. I'm not the first one who says I need help with, washing my linens. So it really opens the door for support. One of the bits that you probably can't see at the bottom was that down at the little kind of conversation bubble down there, it says, another important tip is that it's okay to say no to offers of support. The team wanted to clearly state that as well, is there's also a lot of, well-intentioned offers, and it is okay to just say, absolutely not. Now is not the time, and I don't need support. The next two, going along again with the theme of having kind of thought bubbles and ideas suggested, but also some empty bubbles so that people can fill in their own ideas. So these two pages are offering community support. So that's specifically LGBTIQA+ supports in Victoria and in and around Geelong, obviously. And then the next one is volunteer supports that are specific to bar and health, but there's a lot of opportunities to use those as prompts and get people thinking about what they would like. Next one, please, Ed. And this just continues that idea off in terms of also not just the practical bits of support, but also the emotional support. What is it that makes you feel better emotionally, and the fact that it's okay to take time to think of that and not just the practical bits and pieces. I really like the spot where there's the little arrows back and forth that says or, because the consumer advisors were saying, we often hear that, go and talk to a loved one because they can provide you a lot of emotional support, or you might actually want silence. So allowing space for quiet was really important. And I like that idea that you can dip in and out or back and forth between those two ideas. And as you can see, is the theme through this document is then there's some space for people to have their own ideas. Next one, Ed. The green section is about getting organized. And to be honest, this is the page that a couple of pages that probably sat empty the longest while we were developing this document. And I think it's because of the fact that knowing where to start is really overwhelming. And you'll see that's why there's some really, really simple ideas on there, like hanging up a whiteboard or getting an organizer app. Like just where do you even start can be a stumbling point for people. So finally, we're saying where you can start is some of these ideas. Thinking about your different accounts, like all of this also can be quite overwhelming. So by having the prompts there, hopefully you can start to work through those, and it takes away how overwhelming that part of the planning process is. Next one, Ed. These little thought bubbles were around what does a good quality of life mean and what does a good death mean? So really starting to think deeper about what specific things people want. And I always remember that one of our consumer advisors on this said the most important thing for her is that she can have access to fresh air. And I thought that's such an important thing, that could be at home, that could be in an inpatient unit, but she wanted to hear birds, breathe the air, and that was the most important thing. And so for her to be able to have a place where she can jot that down and let other people know that's an important thing, I think just really sat with me. And this, there's an acknowledgement at the bottom. Palliative Care Australia actually has what they call Dying to Talk resources, which have a lot of these prompts that have been done already. And then what our team did is added in some more LGBTIQA plus specific ones. And then again, more space for ideas. So thinking about maybe some bucket list ideas or just any other ideas. Next one, Ed. Luckily, because of our previous speaker, we've had a good chance to talk through a lot of this element. And so I won't get too far into this, but one thing that I will say is, sorry, I thought I was on the wrong page. There's a part in here about preparing your funeral. And again, I just keep thinking back to the amazing and profound things that the people I worked with said. One of them said, funerals are always this kind of nice thing where the person who's died becomes a bit of a saint and everybody there, was their best friends. And they said, I really want to be able to make clear to my family, possibly who I don't want to come to my funeral. And you could tell that was an uncomfortable topic to bring up, but really important to be able to say, like, there might be people I want in the room and there might be people I might not want in the room. And that's both at the actual end of life and at the funeral. Also, in terms of the specifics of a funeral, what stories we want told, what music we want played is often brought up, but what about what you don't want? What story of maybe your coming out days, or maybe if you're trans, what stories do you not want shared publicly? So yeah, again, just being able to make space and really normalize that it's okay to say, I don't want that story told, I don't want that photo used, or I don't want that song used. Next one, Ed. And those of us familiar with our rainbow colors know that this will be the last section. And so this is shifting, kind of trying to wrap up the journey through this document, if people do it in a linear way, with some of the nice things, and really focusing on the quality of life at the end of life. So what do you want to do? What do you want to try? And at Barwon Health, I'm really proud we had a program that is called Have a Go, which is essentially a bucket list program. And there were just so many unbelievable ideas. When you let people have the space to think about what they want to do, it's amazing what they come up with. I'll never forget the guy who really wanted to get a tattoo before he died, and we were able to help facilitate that. So just giving people the space and the freedom to think about things they'd like to do or try. And then, for those of you who are here who are from Palliative Care Services, is what options do you have to help facilitate that? And to be honest, more often than not, we had amazing people in the community who could help facilitate a lot of bucket list type ideas. And then it ends with quite a few pages that are blank as journal pages. And then one more page. This is just at the very end is some additional resources that are specifically queer, again, so people can see themselves and access queer specific clinicians. And then you can just keep seeing there was so much feedback, people needed space to write their own things. So then at the very end of the document, there's a bunch of space for people to just use as they would like. So Thank you all. We ran through that very quick, but once we get to the Q&A section, I'll be very happy if anybody does have any follow-up questions. Thank you.
Thanks, Jen. That was amazing set of slides, and made me start thinking already. So now's our time to do our Q&A. Come in so far. Has someone else got vision of those?
I haven't seen anything come through either.
So
Let's just have a look. Just got a compliment for you all that's come through, which is nice. Fantastic presentation from Kelly. But if anyone has any questions, feel free to put them into the chat now.
maybe I might start, Jen. One of the things that we're aware of sometimes when we're caring for a trans person is in a hospital setting is we're often the information about, it's often delivering personal care and preparing our staff for, I suppose, some gender confusion, maybe from our staff perspective, not from our patient perspective. In developing this resource, how does Barwon Health kind of manage, I suppose, some of that gender confusion from a staffing point of view, rather than the patient point of view, because we want to protect that dignity of the patient.
Yeah, and I think it's not going to be a huge surprise that it really comes down to training. I was really grateful that for a while I was also in a role delivering training directly to clinicians where we can have those nuanced conversations about gender and bodies without the patient being present. So we could kind of build up understanding from clinicians beforehand. So that absolutely is the number one thing, is doing the training in advance so that I guess there is less of that confusion in the room with the patient. There's things that really can be done around documentation to make things more comfortable for the patient. I know we're constantly running into things around what somebody's legal documents are versus, the way they would like to be acknowledged, or, the body that they have. And it really puts back to clinicians, how can we ask those questions on admission? How can we make sure that the answers are documented, but also handed over between shifts, between, if it's community nursing, however that is, or community nurses, how are we sharing that information to minimize how much the patient has to tell that story over and over? So I think my answer is probably really putting it back on the clinicians of do your work in advance. And then I guess if you do make mistakes around pronouns, just apologize quickly and move on. And it's also okay, to ask people how they would like different parts of their body referred to, and just, I think having that conversation in a way that from the clinician seems comfortable makes the patient more comfortable. So is it breast or chest, all those different things about how people talk about their own bodies. The more confident a clinician is, the better for the patient.
Yeah, fantastic. Thanks, Jen. I'll come to you, Kavitha, if I can. There's a question about the cost of an enduring power of attorney, and it's kind of linked to the second question about many people can't afford wills. How do people get around that if they're on a limited income? Sorry, Kavitha, you're on mute.
Sorry, thanks so much. There's a couple of, I think I saw that first question. Yes, if you go onto the website of the public advocate, they've got a form at the end. So the thing with an EPOA is it doesn't actually cost anything. You actually don't need to even submit the form. You just need to complete it and then keep it in a safe place. So there is I don't know if I can link. I mean, it's a public advocate site. Are you happy for me to link this page to the chat? I don't know if that's, or I don't know if they can see it. But if you go to the Office of the Public Advocate, you can give them a call. I would, if you want to be 100% sure, because I can't refer to a form itself. But if you download, there's right at the end of, it's kind of like a fact sheet about EPOAs, and at the end there's a short form, appointment form, and it will just give you instructions on how to sign it, witness it, It's pretty easy to complete, like you tick the box for personal matters, financial matters, so you don't really need to specify those kind of things. Like I said, it is a bit more of a preemptive document, and it's, as it says here as well, you really don't need to submit it. But if you have any questions, you should call the public advocate. You can contact a local community, if you want to be 100% sure, you can contact a local community legal centre and just check that you've completed the form correctly and everything. Like if you have any questions around completing the form, again, not all community legal centres do all areas of law. It might be Victoria Legal Aid that does it, or maybe they don't do it as well. I think it would often depend on capacity too. So you can, but I think it's the EPOA itself is quite, self-explanatory, and it definitely in Canberra, it's slightly different in from state to state. But I had a lot of clients who had done it themselves. The instructions seem pretty comprehensive as well. But please, just contact your local CLC or Q Plus or Justice Q as well if you're LGBTIQA plus. If you have questions around like how to complete it, if you're not sure around whether you've completed it correctly, then just contact a service. But it's pretty easy to complete. And then I think your other question was around wills. Where was that question? I'm just.
So many of our patients can't afford wills. So Violet's a bit worried about additional legal costs. So the advice was to, talk to a lawyer. So it sounds like it's a community legal centre.
Well, community legal centres don't usually do wills.
Yeah.
I think in limited circumstances we sometimes do, only if there's a spouse and no children, or if there's no spouse and children, because then it's quite like it either all goes to the spouse or it gets split evenly between the children. So it's pretty like, it's not, well, in case there's any disputes and things, it's a lot more straightforward. So I think it can, I think we might, if that person, it sounds like you're from an organisation. Oh, sorry.
It's Violet from PCV.
Yeah, we could have a conversation offline about maybe how we could, because we have limited capacity through like a student clinic that we can do, and that's all checked over by lawyers. Let's have a conversation offline about how far, because I just don't want to make commitments for other lawyers who kind of supervise that. But I think, I'm definitely open to seeing what we can do to work together on these matters. But I think it's unfortunately the case that sometimes people's assets are tied up in something that they can't access, right? And so they don't have any money, and they don't, like, they have Centrelink money, or is the only thing they have. And then as soon as they die, there's like so much, there's like hundreds of thousands of dollars that have been freed up from selling assets and things like that. And it's just like, it's so annoying how we just live in a world where people can be rich and poor at the same time, right? It's just like, it's actually kind of stupid in my opinion, but
Vita, just for your information, Tracy, thank you very much, has put in the links for the public advocate enduring powers of attorney and making a will of it. So thank you very much, Tracy. It's probably a question to all of you, because I think Kelly's raised a really important point. Given this information is so private, what's the best way to support the information to, I suppose, volunteers, community care teams, inpatient hospitals? What's the best way to do that? And I'm happy to take a response from any or all of you about that.
I'm happy to jump in. I think my experience was, and you'll hear me go on and on again about how much, if we can minimize people coming out and minimize people having to retell things, that's going to make their journey easier. And so I think it's supporting the back end of that. People having a conversation with the patient to say, are you happy for these things that you've told me to be written down? Are you happy for me to tell the volunteers that you don't have to tell the story again? I think it's as much of the heavy lifting as the PAL Care team can do as possible to minimize. And just being really overt, saying, that, is this information that you only want to share with me, or is this information you would like to share with the team? Being really clear just sets that person up really well. Because the other thing that is possible is it could be that they have only disclosed a piece of information to one member of the team and they don't want that shared with anybody else. So it can be a fine line to walk, because I know palliative care teams thrive because of how well they hand over information and share information. So it's being really clear with the LGBTIQA plus person, how much do you want this to be shared with the team? And also, how can I help you share this with the team?
There is a question, what is the best way to support the sharing of information? Is that what you...
Yes, Kavitha.
So how to... I think, I mean, like when we, assist clients, we get them to sign an authority, that's just authority of consent to share. And I think, it's kind of, it's like a double-edged sword, because I think, as Jen pointed out, like, I think quite often some of the most effective, like, community organization responses come from being able to share information in a timely manner and, like, prevent re-traumatization and sort of, and I guess applying it to a palliative care context, like, people are going through a lot and, their capacities might be quite limited, and it's obviously a very emotional time. You don't want to be repeating your story to so many people. But at the same time, sometimes, and this is more applicable, I think, to domestic violence situations where, information is shared that maybe shouldn't be shared, and then that leads to a lot of complications. So it can be a double-edged sword, but I think organizations need to center the person who is being assisted and make sure that, that their wishes are given effect to as much as possible. And that's kind of, I think we can try our best, and that's, I think, the most important thing to do. I mean, as lawyers have very strict rules around confidentiality. I would say that, like, we have extremely strict rules. But I mean, with your consent, we can share information to another organization, like with your written consent. But everything you discuss is completely confidential unless you say that I don't want this to be confidential. You can talk to blah, blah, blah about that or something.
It's interesting. So we've had a patient recently admitted who talked about her roommate of 65 years. And it was clearly a very intimate relationship, but they never used the word lover, partner. It was roommate. And I'm kind of curious. So we followed their language, if you like, that they used around the relationship. We never also used, hospitals are now renowned for using next of kin. We used who's your primary contact. And it allowed then a conversation and, in a sense, a gentle coming out to our staff of this beautiful long-term flatmate relationship, which was just a really nice experience for our staff to, if you like, witness, I suppose, this relationship as they saw it themselves. So it's a good question. Thank you, Kelly.
Yeah, and I was just gonna.
Joe,
oh, sorry. Go.
Oh no, I was just thinking about the question about, like, getting the. I think sort of part of the question is getting the toolkit out, right? Like, people knowing that it exists. And I think it is a really. I remember something that really changed my perspective about how much, like, one thing is how much rights you do have in aged care, as one example, which is, this isn't just about aged care, but like, and how little, though, that people can know the rights that they do have, how people can still think, and some of the horrendous stories that I've heard about people being, like, couples being split up and all sorts of things, just for people not realizing they had rights, both themselves and the workers and the organisations. And one thing that always really sat with me was, like, I think it's really informed how I've thought about how we can really be siloed in our community, is that after marriage equality, I remember we had this event for older LGBTI people around Christmas time, and I was talking about how, the yes vote had gone through, and I was talking about how we should never had to go through it, and even though lots of people voted yes, and that was quite a positive thing in the end, and there was rainbows everywhere, we shouldn't have been dragged through it. And I remember this older person saying to me, quite surprised. They were like, it's so lovely to hear you say this, Joe, because basically the exposure that they'd had to marriage equality was watching like Channel 7 news that was on in the aged care facility. Like they got nothing of the positivity. They just got all the negativity of the no. And they were just so shocked that it had been a yes, because they had actually just heard, they weren't accessing the community and the yes. And so they were just like, oh yeah, just like my whole life, you know, we're not going to get married. And no one, you know, their partner had already died, you know, and so for them, there was also a lot of pain there. But it always stayed with me about that we think people are online, that they're on Facebook, and yes, some people are, but people of all ages are not. I'm now meeting a lot of young people who tell me they're not on social media, you know, and so I think it is a really big challenge, but I guess I take it on as a challenge, these things, and try and be an ambassador in my role. And I encourage everyone who works for an organisation here to be an ambassador of the toolkit, really, to take it, to know and push it out there. Someone told me recently about from HARG, from the Housing Action Age Group, that what they do to tell people about HARG is they go and leaflet older people in Paran outside the shopping centre. And I thought, well, I don't think we should do that with the Palliative Care Resource Toolkit, but I did find it fascinating. I was like, because they were just saying, how am I reaching these older people in Paran who are gay and lesbian and trans? And they were like, I'm leafleting the shopping centre. And I was like, wow, good on you, older lesbian, amazing. But it reinforced the idea to me about that she was saying, yeah, how do we reach people? And we've got to be creative. But I think what I take from her is that the chutzpah that she had to basically, you know, we've got to become ambassadors of this work. We've got to take it on.
Yeah, good point, Joe. Tony, welcome very much from New Zealand. So we're an international span. Tony's asked about how we can get a copy of the toolkit, and Tracy again has put the link of the toolkit into the chat. And Maria, lovely to have your question from the Australian LGBTIQ Multicultural Council. And you're interested if the toolkit might be available for multicultural, multi-faith version going forward. Maybe Jen or Violet, is there any appetite for developing it for representing our broader community, I suppose?
I'll go first, Jen. I definitely need Jen's words of wisdom on this, but absolutely, as Maria, as you know, we've done a fair bit of work together in this space, and we want to be as inclusive and diverse as we can be. So I think you'll be getting an email, Maria, in the future about this. And Jen, I did wonder myself in terms of the collaboration and the feedback from community. If you were able to talk a little bit about how community received the resource, and if, you know, there were any elements around multicultural in particular that came through in that feedback.
That's a good question. I think this is going to be kind of a roundabout answer, which is there were quite a few people who didn't identify as queer who picked up the document, and pretty much the feedback said, I just skipped over the queer bits and I used the other bits because they were helpful, which I thought was really funny, because we're so used to forcing ourselves kind of into a document that doesn't fit us. And so I thought, you know, that spoke to the design and the intent that people could find themselves, like there's enough of the bones there that people could find themselves. So that's a terrible way of saying, like, it doesn't necessarily have the multicultural, multi-faith lens specifically. The hope was that the bones and the framework are there so that people could have their thinking prompted, and then they can use all of the different opportunities with the blank spaces and the bubbles to really nail down what's important to them, their community, their faith.
Thanks, Jen. Jen, there's a question here from Barbara asking where can we purchase copies of the toolkit, but we've put the link in. It's free, I gather.
I mean, and it's funny because we got some Barwon Health people on the call, and I don't work for Barwon Health anymore. There's limited copies that Barwon Health has for Barwon Health patients. So for the time being, yeah, it's a digital resource that's available for everybody. But I guess that's the exciting bit with PCV and Barwon Health working together to expand it, is hopefully then there's appetite. And to be honest, the printed document really makes a difference to people to be able to hold it and scribble in it. I feel is a lot better than the digital resource, but for the time being, that is available for free.
Yeah. Sorry, Kavitha, we've got another question here, and maybe you can help. Does the will kit provide a legal intent in inverted commas for those who use cheaper options to make a will?
There are like strict rules around signing wills and all that kind of stuff, which I think there isn't much leeway around that. I think it's mostly just, I think with wills, it's the complexity is, I mean, those formality requirements of like signing each page of witnesses and all that kind of stuff, but also the wording can sometimes lead to a lot of conflicts. Like sometimes if you say, you know, I'm going to leave this to blah and blah, but not blah, that's a lot clearer than saying I'm going to leave it to blah and blah, and you leave out your third kid, and the third kid then makes a claim to the estate. It's like, I wasn't there, but that doesn't, like, there's no proof that they intended to leave me out. And it's like, well, there you go, like the whole thing. So I think that's why it can be tricky, but I think it doesn't have to be like, you know, it's not like one of those things like certain court applications that have to be made with like a barrister and stuff. But it's not like one of those things. Like anyone can make a will, and you don't have to have a lawyer, but it's just can prevent any disputes arising about validity if you probably get a lawyer. But I think it's like, I think just kind of do what you can with the resources you have. I think it's important because it can possibly, I mean, this is probably a bit too high level for me to say, so not really legal advice, but possibly it could even be relevant to like establishing what your intentions may have been if, you know, someone tries to dispute what your intention was. It could come into play the fact that, you know, someone tried to leave a will, but like that shows what their wishes kind of were. So I think I'm not so sure that I'm getting the question right, but I think if there is, I think another way you can another thing you can do, which I think I mentioned, is you can get a doctor to sort of say that you were of sound mind. So then that way, you know, your third kid, Jack, coming along and saying that, you know, mum wasn't of a sound mind is like a lot more harder to say, because this doctor who's experienced in assessing people and saying whether they're of a sound mind has said that this person is of sound mind. They understand what they're doing and the implications of it. Yeah, and you don't need to be able to know, you need to have a general, like, generally you have a general idea of how much is in your will, left in your will, but not like everything down to the number or like the monetary. There's no requirement that you need to know everything down to the cent or things in, you know, specifics, like we're not all financial planners or lawyers or whatever. So I think that can be another way to safeguard, especially if you feel you don't have enough money for a lawyer or something. You can maybe get a doctor to say that you were of sound mind, so that way that wouldn't be an issue. But I think at least making sure, if I know the wording stuff is like, that's like it might be an issue, it might not be an issue, but just following the formalities around witnesses and signing, that is pretty important to just be wary of. So yeah.
Thank you, Kavitha. Are there any more questions? Here's your last chance, guys, out there listening, watching. I think we're out of questions. So let me make some closing remarks, and I might ask Ed to share the slide with the QR code for your feedback, if I can, as I'm making it. So a very big thank you to Joe, Kavitha and Jen for a very illuminating and wise discussion around the rights of LGBTIQI plus people facing end of life. Also, a very big special thanks to Palliative Care for hosting this event. It's a really important discussion to have in National Palliative Care Week, I believe. My choices, my rights, a conversation on LGBTQIA plus rights in palliative care. I think it's been a really worthwhile discussion, and I feel like I'm fairly informed as a gay man working in the sector, but I feel I'm coming away with more insights after our discussions. So a big thank you to everyone, and a special thanks again to Violet, Joe, Kavitha and Jen for a great session. Thank you very much.
Thank you. Thank you very much.